Is the roadmap of what we're going to do today. We're going to describe two common routes, and that's going to be topical and oral, don't you think? We're going to define, we're going to have a lot of definitions. Now let me explain something about definitions. You may look at a definition and you immediately have a blockage that I don't want to memorize that. I don't want you to memorize it either. I want you to understand it. If you understand it, there's no memorization necessary. When you see those words again, systemic and local, you know exactly what we're talking about. Because we're going to have a lot of terms on this next two lessons. I just want you to understand them. If the word still doesn't make sense, and I have had in my lifetime many times, the word didn't make any sense, and they're trying to explain it to me, and I still don't know. Let me know, because if I can't help you understand it, someone around in the classroom might be able to help you. We're going to define what's called desired effect. What do you think that is? It's what we want to have happen. It's what we want the drug, and we talk about medications as drugs. So that's the term we're using the whole time. It's drugs. Medications are drugs. It's what we want that drug to do. What is its use? What do we want? We're going to talk about causes of medication interaction. Medications can interact with each other. We're going to describe how medications are eliminated. Did we not talk about that they were metabolized by the liver and eliminated by the kidneys? Did that come up before? Yeah. Okay. And we define 6 different types of effects that result from medications. That's a lot of those words. There are all these effects. So let's get started. First of all, that general, which is systemic effect, and local. It's just what those words mean. Systemic is we have a body system. So if it has a systemic effect, it affects the entire body. You have a headache and your knee hurts, but your knee hurts all the time, so you take the pill for your headache, but it'll make your knee feel better too, won't it? Because it's getting throughout your entire body. So your general action or your general effect is a systemic one. It affects the entire body. Then we have local. What's something you could think about that is a local effect?
Topical cream.
Topical cream, cortisone, which is going to affect, you're putting that cortisone on because you have a rash probably. Or you have a little swelling because of an ant bite. So you're trying to take care of something locally. It can get in your system, so if you have an allergy to that, it can still give you a reaction, but it doesn't quite get everywhere in your body like systemic does. We are now using some medicines local, they're putting them on locally, and we want a systemic effect. Patches are one of those examples. Nicotine patches is one that I know everyone's heard of. That's a systemic, but it's applied locally. So we have kind of messed up these terms by the fact that we're now using a lot of topical. We used topical before, but we're really getting into that. And so the other thing to know that if you touch that as you're administering that medication, if you put your finger on that patch before you slap it on their arm, you'll get that effect. You'll absorb it topically as well. So you don't touch the pad part. It makes sense when you think about it, but sometimes watch yourself when you open a Band-Aid. Do you ever open a Band-Aid and you're holding the top of the Band-Aid part that's going to go over the sore as you're taking that's a clean dressing. We don't really need to touch that, but we tend to do things just out of habit. And so if you were touching that patch as you take off the tape or whatever's on the tape, you could be doing the same thing. We generally wear gloves when we do anything topically. It's for their protection from us, and it's for our protection from the medication. Okay, 3 primary outcomes. Now this is in your book, and you know, if my helpers up here will help if I'm off the page, because I tend to flip around. I do better as we go through these chapters, but I don't like the way it's organized. I'll have to redo this for them one day. But 3 primary outcomes are those desired effects that we talked about, side effects, something that we expect to happen, but they're going to take that medicine anyway, being drowsy after you take the Benadryl. We expect you to be sleepy, but you need the Benadryl. Any antihistamine, unless it's called non-drowsy antihistamine, is going to make us sleepy. And then another outcome that is very important is no apparent effect. Why is that important? It's not working. Who knows it's not working besides you? The patient may, but who needs to know? The doctor. A common thing that we do is we go to the doctor. First of all, we tell the doctor what's wrong, and they say, why did I have to tell him what's wrong? He should have figured that out. No, 80% of the diagnosis is what you tell them. Now they give you a prescription, you go home and you try it, and you say, I'm not going back to that doctor. It didn't work. There are 100 different things that might have helped you. They were trying one. Let's go back and let them know that didn't work. And let's figure out what's another one. They already know a lot about you. So it's a lot easier to go right back to them and let's let them know there was no apparent effect. It's very important, that communication with you and your doctor and with your client and their doctor. Oh, see all these words? But they're all words, as we talk about them, you say, yeah, I know that. The primary desired, we've already talked about. That's what you expect to happen. Secondary is the side effect. Now, there are times when the secondary effect, that side effect that you want, is the primary effect. If you look on the shelves, sleep aids are primarily diphenhydramine. They're primarily Benadryl. They're marketed as a sleep aid, Tylenol PM. You know what's in it besides Tylenol? Benadryl. Advil PM. You know what's in it besides? Benadryl. Excedrin PM, generally what they've done is they've just taken the caffeine out because there's caffeine in Excedrin. So they take the caffeine out and then you can sleep. So a lot of times what is considered the side effect is becoming the primary. Tegretol is a medicine for seizures. Do any of you have aggressive clients that are on Tegretol for aggression? Or Depakote? A lot of times, again, that's a medication, primarily a seizure medication, but the side effects are helpful. So even though it's a secondary side effect, they may be taking it for primary. Now, why is that important? Because you need to know why they're taking the medicine. So if they come in with a medicine that's for seizures, and the formulary will tell you it's for seizures, because that's what it's going to spit out. You need to say, why is he taking this medicine? It's important that you know. I had someone one day say, well, I don't know anything about what the medicines are that they're taking. I just know when to give it to them. It's important because that's only one little piece of medication administration, is actually assisting with that administration. Okay, adverse.
I have a question.
Yes.
I've always, when I've administered meds in the past, I've always been told not to give Benadryl as a sleep aid. You know, some kids would want the Benadryl because they couldn't sleep at night. But I was told if you take diphenhydramine regularly, it could harm your liver. So why is it being marketed as a sleep aid if it could harm your liver?
I don't know that it does harm your liver.
Okay.
Antihistamines are not necessarily big for that.
Okay.
Any medicine has that potential because it's metabolized by the liver. The reason that a lot of times Benadryl is, she's been told that Benadryl is not always a good thing. And some of them have a different, but it's an antihistamine. Because antihistamines, as a general rule, are make you sleepy. But some people feel like they're kind of groggy in the morning. They don't really, they wake up, if they don't take the shower in the morning, they can hardly get out the door. And so it gives you a sluggish feeling the next day. So some physicians are not real hip on Benadryl. But some say, hey, there's no side effects for Benadryl. If that helps you sleep, that's one of the best things to take. The other thing about sleep aids is we're going to talk about tolerance. You can become resistant to the effect of that medicine. Antihistamines are real famous for becoming tolerant to them. So if you take Benadryl every night, it's going to take more Benadryl to help you sleep than it did before. And sleep aids in general, Restoril, some of those that are advertised on television, and some of you don't even watch ads on television because you flip around. But if you watch some of the ads, and this is a good time when you're learning about medicines, to watch them and see what they say, because they always tell you these side effects, don't they? And they can tell you some adverse effects. But watch them. But anyway, all of those, it'll say only recommended for 2 weeks or something like that, because they don't want you to get tolerant and then feel like you're not getting any effect. That's why antihistamines, okay, this is fall, it's ragweed. If this is when you get watery eyes and runny noses and sneeze, then this is when you take an antihistamine. Don't take it all year round because ragweed is a problem. And because it won't help you as much if you take it all the time. Again, it's an antihistamine. All of those allergy medicines are antihistamines. Okay, adverse. Adverse is something we don't really expect. For instance, Benadryl again. Some kids on taking a Benadryl become hyperactive. Isn't that funny? Something that makes you sleep, makes them hyperactive. It would be an adverse. It would be an unexpected side effect. Although we kind of know that now, so we could look for it. But we're all different. Even though we're all human beings, we all have the same, if they told you what your scientific name was, we all have that same scientific name. But we all are a little bit different. We all have what's called idiosyncrasies, unusual things that are ours alone. And we might respond to something differently than someone else did. So it could be an adverse or unexpected. Doesn't that make sense that adverse would be unexpected? Okay, allergic. We're all the same too, however, some of us are hypersensitive. Now, if you take codeine and it makes you sick to your stomach, you're sensitive to it, but you're not really allergic to it. Allergies have to be hives, rashes, in addition to, maybe it makes you sick to your stomach or sneeze or watery. But if it's really an allergic reaction to something, and it's more than just hypersensitive, you actually get hives or rash. So when they ask you what your allergies are, it's really those things that would be something that would be harmful if you took it. And that harmfulness could be anaphylaxis, which is, and it's not on here, but that's when you actually have a swelling of your face, neck, trachea, and you can't breathe. And you know what? Giving you breaths isn't going to help you because it won't go through. So that's why there is a note in the physician's office generally after you take an injection, wait about 10 minutes. It's mostly, we see a lot in the pediatrician's office, because if you're going to have a harmful reaction to that, even though you've taken penicillin all your life, but this time you have an allergic response, you're never going to be able to take it again, but you best be in the doctor's office when that happens, rather than in the car, or have your child in the back seat in a car seat, and you realize, because that's what they'll be doing. They can't breathe. Toxic is different than that, because toxic means it's affecting the liver or some body organ, because things are metabolized by the liver. They all pass through the liver. There's all of the medicines that you see that your clients are going to get lab work for, especially seizure medicines. There is a window of what that effect would be. That window, if they don't have enough in their blood, they're going to have no effect. Dilantin, no effect. Tegretol, no effect. If it's below what the level needs to be. If it's above that level, it's going to become toxic to their liver. And they're going to look drunk, because toxicity to the liver makes them look like they're drunk. They're staggering, their words come out slurred. So we have to think about toxic. Now, because we're not all the same, someone may start taking a drug that we're not really worried about toxicity, but if they have a change in their behavior that's not normal for them, because you know them, it seems strange, we need to find out what we have to do about it. And it may be that they're going to need to have blood work, see that we know they're going to see the physician if they're having a change in behavior like that. And this could be the problem. Cumulative. That's not a word we use a lot, but if something culminates, it's growing. And if you have a buildup because the medication is not eliminated, now something's going on with your kidneys. Because we know that the medicine is eliminated through the kidneys generally. So it may be affecting the kidneys, or either your kidneys are not working well for some other reason. Diabetics can have problems with their kidneys, and all of a sudden this medicine along with their diabetes is creating kind of a toxic effect to their kidneys. So if it's not eliminated, it's going to build up in their body, and they're going to have a stronger effect than what is necessary. That's one reason that you can't drink grapefruit juice with cholesterol medicine. It makes it cumulative. It builds it up, that cholesterol medicine, and the physician doesn't have a clue what you're taking because he doesn't know how much you're really getting into your system. And cholesterol medicine is toxic to your liver. That's why you go in every 6 months for a liver function test.
He was explaining to me that you can't take the blood pressure medicine with the orange juice or grape juice for blood pressure medicine.
She's asking about an interaction with blood pressure medicine and grape juice or grapefruit juice. I don't know that, but I'm not saying that's not correct. It could be correct. Anything that is, when the medicines come from the pharmacy, anything that needs to be done with that, like give with food, don't give with food, should be on that label. If that's something you've heard but you're not sure, call the pharmacist. That's your first lifeline, is the pharmacist. I've heard that it's not good to do this, and so I don't really want to do it unless you tell me it's really okay. Because don't we have clients, I mean, hey, I have a son who had ear infections when he was young. He still has all kinds of rituals with his ears. You know, he's not going to do certain things without Kleenex and whatever. And so they're very ritualistic. And if they want grapefruit juice in the morning and that's something they want, it's going to be hard to not let them drink it. And so you want to know if that's good or bad. And if you've been told that, but it's not on the thing, I'd still ask. And you don't even have to call the pharmacy. You can just, when you're in a pharmacy one day, you can ask the question of the pharmacist. We're finally teaching our pharmacists to be teachers. At first, they didn't like that. They were behind the thing. And then the law came out saying they had to teach us about medicines. And at first, it was verbally, but they quickly got out of that and they can give you a writing. So they don't have to stand there and teach you, but if you want to be taught, they have to. So when you ask a question, they're there to answer it. Does someone else ask something?
Yeah.
Yes.
What you said about cholesterol medicines couldn't be taken with grapefruit and their own said.
Yeah, you cannot drink grapefruit juice with it. In fact, you're not supposed to drink grapefruit juice all day. And it's but it's because it makes the effect of that cholesterol medicine greater. So if you're on 20 milligrams and you drink grapefruit juice and you don't even do it every day, what is your dosage? You don't know because it's not what you're taking. It's got some cumulative effect to it. It's really not cumulative. It's really synergistic. It really potentiates it. What? You be drunk? Oh, she said, well, it might have then affected your liver. because it does affect your liver. And when things affect your liver, that's when you kind of start looking drunk. Okay, okay. But anyway, the point is, the point of this is not to make you know everything about it. It's to make you know, it's to make you respect medication. Medication has, you know, all of these different effects. If that's yours going off, and here you are, way away.
Sound way good. Sound way good.
Okay, can you see that, you know, one of the things that people have done in the past is they said, you know, if aspirin's good for me, and I'm supposed to take a baby aspirin every day, I'm going to take 2 of those because that's what would be better for me. Or if, you know, this works, then I'll take more because that will make it better. No, more is not better. The dosage is what you need. If the dosage isn't working, you need to talk to the physician, because the physician is looking more at more things than just that dosage. They want to know what that dosage is. So that's why they say, and in fact, I said that cholesterol business with cumulative, and that was really incorrect. It was really synergistic. Did I confuse you then? But cumulative does mean that it builds up in the body. Okay. Tolerance, we've already mentioned, is resistance to. You know about tolerance. You can't stand them, and you can't tolerate it, so you're going to resist. Idiosyncrasy is unusual effect. Psychological or emotional. Now this is a psychological or emotional. This is a dependency based on the fact that I better take my Benadryl or I won't sleep. Has nothing to do with the physical, it has to do with what you think. And as a lot of times elderly people get in that kind of thinking, I better take something for sleep or I won't sleep tonight. They also get that way with laxatives. Better take this laxative or I won't go again. But that's an emotional dependency. That's a mental dependency. Physical is more like addictions. A dependency that your body needs or it's going to respond in a negative way. So physical dependency is like drug addiction, alcoholism. Now some of our scheduled drugs like phenobarbital is addictive. It is one of the scheduled drugs, but it doesn't have as much of an addictive effect because you can take them off of phenobarbital and they don't go into any kind of physical issue with that. And they usually, what they do is they replace it. They take them off of phenobarb and put them on something else. And that's the same thing with a lot of the mental health drugs. All of your psychotropics, which are your mental health drugs, many of your Valiums, see those are scheduled. Antidepressant drugs are not scheduled, but anti-anxiety drugs are scheduled, like Valium, and I can't even think of another one right now. But anyway, but they can replace them, and therefore you don't go into any kind of withdrawals like you would with some addictive. But that is a physical dependency. These two can be combined somewhat. You may have emotional need to have that physical taken care of. Synergistic is what I was getting into with some of those drugs, like the cholesterol drugs. Synergistic, if something's synergistic, it works with something else. And in this case, it potentiates, it's increasing the effect of one medicine. That's why we give phenobarb with Dilantin, because otherwise you'd have to give more Dilantin to make that work for seizures. And with the phenobarb, you get less Dilantin, less phenobarb, and the two work together synergistically. One medication increases the other. Now with that cholesterol medicine in grapefruit juice, foods can also potentiate. Cannot alcohol decrease the effect of something or increase? They tell you when you get on an antibiotic, don't drink while you're on this antibiotic because it decreases the effect. It's antagonistic. Antibiotics decrease the effect of birth control pills. Do not count on your birth control pills if you're on an antibiotic. And they tell you that. They should tell you that on there. It's somewhere in that literature. You have to read it. That's why it's important to read. Now that, you know, it might have helped, but we don't know for sure. So don't count on it. But synergistic means it increases. Alcohol increases the effect of every other central nervous system drug. That was the Marilyn Monroe syndrome. Drinking and having sleeping meds at the same time, supposedly, is what killed Marilyn Monroe, and has killed many other people since, hasn't it? A lot of these overdoses are not really an overdose of that drug, but there's something else they took that probably, unless they intended to overdose, but if something else they did that increased that effect, and they thought they could still take the same amount of drug as they'd taken before. Lots of names, right? But don't all of those make sense? So if I were to say anything about resisting the effect, and this could be, but you know, y'all need to know, y'all just need to have more of an understanding. You're not going to take a state test, and you're not going to be certified, but you have to understand, really respect medications, and know that when it says on that label, give 30 minutes before a meal, it's supposed to be given 30 minutes before a meal. There's a reason for that. When it says do not take with milk, there's a reason for that. Read the literature. When you are working in the home and your resident has been put on a new medication, in the record book there, somewhere, there should be the printing out of what that medication's all about. Read it. See what it is they're on, and what are the things that you need to pay attention to. Okay, yes, yes, you sure
Why is
can.
it that they ask you if you're allergic to eggs before they give you a flu shot?
Okay, she's got a question about why do they ask you about allergies to eggs before you get some immunizations, and that's true for childhood immunizations either. That vaccine is made in the presence of. Within, somehow, eggs were a part of making that vaccine. Used to be, some new mothers here might be able to tell me, used to be that we could not give our children eggs until after they were a year old because they needed to have their measles shot before they ever got eggs, because measles was made within eggs or around eggs somehow.
When did they, that was early 60s or something?
That was, my kids were in the 70s.
You can
But-
give eggs now, right?
I don't know. That's what I'm saying. Some of y'all that have had children in the last 10 years might. But she's just saying before she got a flu shot, they wanted to know if she was allergic to eggs. And so they've still, vaccines are,
I don't know that. They could be hurting them later on.
well, they do ask you things. You know, before you take, if you go to Kroger's to get your flu shot, they're going to ask you some questions about your health issues before they give you that flu shot, or anywhere that you go. Okay. Forms of medications. Let's go through this before we take a break, and we'll be taking a break in just a minute. But medications come, and I have to, let's see what page we're on. 35. Because I popped over that 35, and now we're back to it. So 35, 36, and 37 are pretty much what we're going to be covering now. Okay, medications come in a variety of forms. Oral and topical are what we use the most. So let's look at those. Tablets are just pressed powders, and they can be scored. Did we talk about scored? I'm sure we did.
Yes.
You know, I have 3 classes going, and so sometimes I'm confused as to what I said where. But a tablet that can be cut has to be scored. Tablets are just compressed powders. If you try to cut it, it's going to fall into multi-powders. Capsules are in a shape, they're actually in a little gelatin capsule, and there's medicine inside, and that medicine could be a powder. You might have taken that apart and put that powder in food one time because you didn't want to swallow that capsule. But now we also have caplets. Those are those pressed powders that look like capsules. And it used to be that you could tell if in that capsule was something that was going to be released over time, you could actually see those little pellets in there. But now you can't tell if there's something that's going to be released over time without reading about it. Does anyone take a medicine that you only have to take once a day, or any of your residents, because it's effective for 24 hours? And there are antibiotics now that are effective for several days, just one capsule. And it's because they were chemically made in such a way that it's released over time. That might come up again in a minute. Like I say, we repeat. Liquids are another oral medication. One of the things about liquids is we always have to consider that it might settle. It might be like oil and water in that liquid. Lots of medicines do. Maalox, if you ever had Maalox on your shelf and you get it out and it's got some watery stuff on top and creamy stuff on bottom, can do it. Cough medicines can do that. Dilantin does that. Antibiotics, amoxicillin for children, separates. Always know, it doesn't matter if you think it is not separating, it's just a rule of thumb. If you're going to give a liquid, they say shake, but this is shake, I say stir. Because if you make bubbles, how are you going to measure it? You want to measure it accurately, and if you're pouring out something with bubbles, it's hard to determine. So stir that medication, and you stir it, not with a spoon, but with a movement like a shake, but it's a stir. Okay, so when we think about tablets, we're thinking about, first of all, they should take it the way it comes, but it's powdery, so it doesn't swallow as easily. Capsules can have a coating on them, although tablets can have a coating too, that sugary coating or enteric coating. Capsules, just a different shape, can be the gelatiny little capsule. Caplets and liquids. Topically, we have ointments or creams. I think they mentioned creams and lotions in here too. But something that is just going onto the skin. And the one we use the most is what? Ointments for our residents, Neosporin probably. Do they have Neosporin on there? And then hydrocortisone is another one. It's probably on their PRNs. You always administer that with a Q-tip. You can use a gloved finger, but doesn't it look better? Wouldn't you like your